Hi, Dr. Jeff Banas, and I'm going to talk about a therapy procedure that gets really good results for a lot of chronic conditions, a lot of chronic sports conditions, plantar fasciitis, shoulder issues. I get a lot of patients that come in like for plantar fasciitis or shoulder problems, whatever, and they have had they've had injections, they've strengthened the area, they've had cortisone shots, but they're still having problems. And when we start getting in there and actually start working the muscle and releasing the adhesions, a lot of that pain really clears up. And some people kind of say it's pretty remarkable how fast things get better when they do this, even though they've done all this other therapy. And it is a great procedure or technique. Sometimes it's only it's thought of like a little extraordinary technique because people go do it only after they've gone through a bunch of therapy and injections and stuff like that. And I'm going to show you why and why this deep tissue active muscle release could probably help you even though you maybe had a lot of therapy in the past. So when we look at a muscle, we got the muscle fibers like that. And whether it's a repetitive strain or if it's acute injury, whether you're running, you pull the hamstring, or you're just repetitive strain, working on the mouth all the time and causing problems, or tendonitis or little tears in your forearms, the body basically gets a little tear. So it's almost like the little fibers tear. Now what happens is they don't just heal by connecting back to each other like this. What they do is they heal by kind of laying a fibrous adhesion all over the area. So it pulls and then it just doesn't heal together, and so it crisscrosses. Now what happens when we get a muscle like adhesion like that, first of all, it's going to be tightness, okay? So that muscle is going to be tight. And it's going to be restricted. The motion's not going to be, you're not going to have as much movement. Think of having a balloon, and you put a piece of tape on the balloon, and the tape is that adhesion. Now blow that balloon up and down. That area is not going to move as much as you can. And if this is the problem, this is what needs to be addressed. But what we see a lot of times is the true problem is not ever addressed. So when someone comes in for an appointment, or if you're suffering with like a knee pain, a shoulder pain, or let's say Achilles pain, people say I have pain at the Achilles tendon insertion, okay, that little tendon attached on the back of the heel. And most of the treatment is going to be aimed where? At where that tendon attaches in the Achilles. And there might be some inflammation in there, okay? Injection in that area, electric muscle stim in that area, and some stuff like that could help. But really, when someone comes in, you need two diagnoses. One, what's the problem? And that would be like Achilles tendon inflammation. But two, why is there inflammation and tension there in the first place? And like in the Achilles tendon scenario, once you go up into the calf area, usually on the inside of the calf, and start digging in the calves, you're going to find a lot of knots. It's going to be very tight in there. And a lot of the reason is because you have these adhesions in that area. Now, if we do a cortisone shot or electric muscle stim or everything at that attachment where the Achilles comes in, yeah, the inflammation might go down, but you didn't address all the tightness in the upper calf. So that's going to continue to put tension on that Achilles. So we need to address the problem, and that has to do the same as the shoulder, but the neck. You might find areas in the neck that you have these adhesions, these restrictions. And if you're just seeing a chiropractor and they're just adjusting your neck, but they're not addressing the adhesions, well, that's probably one of the reasons why you're still having a problem. Now, the form of therapy that's great is an active range of motion while you're applying deep tissue. Meaning, if you got adhesions within here, simply massaging that area, it's going to loosen up, but it's really not going to break the adhesions up as much. Foam roll, the stick work, all that type of stuff is good, but it's not to be as specific. So what we really need to do, we basically take a contact on that muscle where we feel that adhesion, and then we lengthen that muscle. So like if we were having an issue here in the forearm, and we find adhesions right here, the therapist may take a contact on that deep tissue while you're lengthening that muscle, and that lengthening of the muscle over that adhesion is what's going to kind of get this thing going, breaking there. So that's lengthening as we're breaking that up. I'll be honest, sometimes it's not the most pleasant thing, But if you've suffered from, like I said, if you've suffered from basically almost any condition, if you feel these adhesions and knots, we've treated people with a lot of degenerative knees or someone who's even had a knee replacement, and maybe their knee replacement helped, but they're still having issues. And like when someone has a degenerative knee or knee replacement, that's okay. The problem's the knee is degenerated, but diagnosis number 2: what caused that degeneration? These adhesions and these knots all around the hips and area, and you cannot just treat the area of the pain. So a great form of like active myofascial release. It's different than massage, not just getting a massage, but actually taking the contact on that muscle and breaking that type of stuff and stripping that muscle and breaking that up. It really is a fantastic technique. So check someone out who does that form of active myofascial release or active release. And I'll do another video that shows you a little bit how to do some of this active release or muscle release on your own in the next video. If you have any questions whatsoever, feel free to drop me an email or a phone call, and I'll be happy to help you out as best I can.